I'm going to be giving this talk on epidemiology of HIV and treatment, and I'm going to be focusing on these 90 targets that are driving the response in Europe and Central Asia. So, as Jürgen said, I'm employed at ECDC and I have no disclosures. So this is the outline. I'll be focusing a few slides on epidemiology, and I'll focus most of my presentation on the global targets and where we are in Europe and Central Asia. And what I really want to highlight is the inequalities that exist in our region, between countries, between subregions of our WHO European region, and within the subregions. So that's what I'll try and do. So WHO categorizes the region into West, Center, and East, and this is the categorization. It's a historic decision that still exists, both in terms of epidemiology and response. And the historic reasons, I think, is that in the West, the HIV epidemiology has been driven by sex between men, whereas in the center it's been heterosexually driven, and the eastern parts of the region has been driven by people who inject drugs. But this is the categories that they use, and we do joint surveillance with WHO, so this is what I'll be using in my slides going forward. So in 2016, we had more than 160,000 new diagnoses in our wider European region. Russia alone accounted for over 100,000 of these cases, of course. So 16% of these diagnoses are in the western parts of the region. It gives us a rate of 6.2 per 100,000 population. 4% of these diagnoses in 2016 were diagnosed in the center. It gives us a lower rate, 2.9 per 100,000 population. And as said, in the east, where the vast majority of cases are diagnosed, we have a rate which is much higher, of course, of 50.2 per 100,000 population. So this slide shows you new HIV diagnosis by transmission mode. This data lacks data from Russia, so we don't get data from Russia, disaggregated data, so it's not really a fair picture of the situation. But for all the other countries that are able to provide data disaggregated, we see that heterosexual is still the main mode of HIV transmission in the European region, followed by men who have sex with men. We do see an increasing this gray category of other undetermined, where countries are more and more unable to categorize where diagnoses are occurring, and that's a bit of a concern. So UNAIDS and WHO have published figures recently over the past couple of years showing dramatic declines of HIV infections globally, from 2.5 million in 2007 to around 1.9 million in 2016. So this is very positive. But if we superimpose the European data onto this, we're the only region globally which is moving in the wrong direction. So you see the different scale on the right-hand side here, but this is the wider WHO European region moving in the wrong direction as opposed to all other regions globally. And if you break this dark line down to the different subregions I talked about, you see that we're seeing very different patterns. So let's see if this... There, you see here. So this orange line here shows you what's happening in the east. So what's happening in the region, of course, is what's happening in the east. For west and center, we see pretty much stable trends over the past decade. So this is, of course, nothing new, but it's still very important. So in terms of the continuum of care, this is something that we embarked on in 2014, just before WHO released their new strategy on the 90 and UNAIDS. And so what you see here is the data availability on the continuum of care. And I'm also thinking, because I'm helping my colleague Erica, who works with hepatitis now, to try to do something similar, build up a monitoring system around hepatitis. So what I envisage what will happen is that we're going to start from much lower rates when it comes to hepatitis, but we will see improvements over the next couple of years. But anyway, this is the data for HIV, and as you see, we've seen improving availability of data across all steps of the continuum of care. The biggest challenge we have is around this first estimating the number of people living with HIV. UNAIDS has a modeling tool called Spectrum, which many countries have been using in Europe and Central Asia to estimate the number of people living with HIV. Many countries in our region feel that they are overestimating that number, and UNAIDS are taking this seriously and adapting their modeling tool. But ECDC embarked on a project a couple of years ago to try and provide our own estimates based on strong case-based surveillance. and more countries are using this tool, and it does show differences between the different tools. So we're working with UNAIDS to try and improve this. But as you see, since we started implementing this modeling tool, more and more countries are able to provide solid estimates. The other area where we've seen challenges in data collection is viral suppression. And as many of you, I assume, are clinicians, this is something where I come from the public health field, and the people that we are dealing with have expressed a sense of frustration on trying to get this data on ART and viral suppression. And over the past 2-3 years, we've been working with EACs, with the cohorts across Europe, to try and bring public health and clinicians together and to improve estimates. And we are seeing improvements in this area, but there's more work to be done. So I'm sure you're aware of these targets, but the targets set by UNAIDS and adopted by all countries at the UN General Assembly is to diagnose 90% of all people living with HIV. Out of those, 90% need to be on ART, and out of those, 90% need to be on viral suppression. According to UNAIDS modeling, this will set us on track to end AIDS by 2030, which is the SDGs. So this is a medium-term target, 2020, and in 2025, this increases to 95%. So I'll start showing you data now across all these 4 steps, starting with the first 90. So what you see here is we have 39 countries who are able to provide data on this. You see the UNAIDS target, the red dotted line, 90%, and the regional average is currently at 80%. We see a number of countries in the green bars that have reached this target already. A big chunk of countries are above the regional average in blue here, which we think are on track towards ending or towards achieving this global target of 90%. And on the right-hand side in orange, we're seeing some countries, especially to the right hand here, which are facing huge challenges when it comes to testing and diagnosing people living with HIV. So this means that in our region, 1 in 5 people living with HIV in Europe and Central Asia do not know they are infected. So testing is one of the key priorities in our area, in our region. So what I'm showing you here is sub-regional variation according to this West, Central, and East categories. So as you see, 86% of people living with HIV in the western parts of the region know that they are infected, so the diagnosis rate here number is approximately 15%. In the center, this is 83% that know they're living with HIV, and this drops to 76% in the eastern parts of the region. But it is really important not to just look at regions, as I said before. There's huge variations within our regions, less so in the western parts for this specific target, between 74 and 93%. But as you see in the center and east, there's huge variation within countries. And what's really important here to state is that countries in the eastern parts of the region and the central parts of the region, several countries are outperforming countries in the West. So it's not as easy to just say Western countries are performing better. So it's important to look at these differences. And what I forgot to say is this is unpublished data, so we have validated with these countries. In the next couple of weeks, this data will be published, so you're one of the first ones to see this. So this comes from our surveillance data, showing that not only is undiagnosis a huge issue, but actually late diagnosis is a very important issue in our region. So this is numbers for the EU-EA, showing that 48% of all people with a CD4 count reported are diagnosed late in our region. We see a very small decline over the past decade around this issue. So this is a persistent problem that we are dealing with. This shows you late diagnosis by demographic. So you see the 48% here in the gray bar and the red dotted line. And what you see for gender, for example, you see that women are diagnosed later than men. You see in terms of age groups that the older you are, the more likely you are to be diagnosed late. And so some transmission modes, you see heterosexual men and women and injecting drug users are diagnosed later. And when it comes to migration or region of origin, we see migrants coming from sub-Saharan Africa at the far end here. From sub-Saharan Africa and Asia are diagnosed later than other migrants. So this is something that we published quite recently. We're using our modeling tool to try and estimate the time from infection to diagnosis in the EU. And as you see here, the median time from infection to diagnosis is 2.9 years. That's the gray dotted line on the left there. But what you see also differences in the region here, where in the west and the north, the blue colors on the map are, sorry. there, there's a shorter time between infection and diagnosis than it is in the south and eastern parts of the region. So moving on to the second target. So once you are diagnosed, you need to be put on treatment as soon as possible. So we have 39 countries able to provide data on this issue. You see more countries here in green have reached this target already. We see a significant number of countries in blue that are above the regional average of 64%, and a few countries on the right that are going to face huge challenges reaching this target. So that means 1 in 3 people diagnosed with HIV in our region are not on treatment. And you know that the treatment policies are changing in Europe, but still a third of people who are diagnosed are not on treatment. It's quite surprising. So looking at the variations between regions, so we've reached this target as a whole in the western parts of the region. We're at 73% in the center, and only less than half of people diagnosed in the eastern parts of the region are on treatment. Again, looking at the sub-regional variation, you see huge variation within all 3 regions. So as I said before, policies are really important when it comes to trying to put people on treatment, and we follow this since 2014, and as you see here, most countries started treatment at 350 cells, and that was according to the international and national guidelines at the time. But in 2015, both WHO and UNAIDS came out with guidelines suggesting to test and treat. And in 2016, many countries followed very quickly, adopting these policies. Now, there's one thing with adopting policies, and there's another thing to implement it. And I think that's where we are now in terms of implementation. We will see the results of this huge shift in the coming years. But in 2018, that we're just about to publish, we see now that basically all countries in our region have moved towards test and treat. And this is really positive news. Speaking of treatment, I think it's important to highlight that there is one group in our region that are not even entitled to treatment, and that's undocumented migrants. So more than 50% of countries do not provide treatment to undocumented migrants, and this is going to be a bottleneck if we're going to reach this target. Not that there's a lot of evidence that undocumented migrants carry a huge burden of HIV, but this is kind of shameful for our region that so many countries are not providing treatment. And we don't see a shift. We've been following this over the last few years as well, and there's more countries moving towards the red actually than towards the green. Moving to the third target of once you are on ART, are you reaching viral suppression? And as you see here, as a region as a whole, we're doing very good here. This is not very surprising. We know that treatment is very effective once you're on it. But many countries have reached this target already, except for on the far right-hand side. I think personally that this is something it's not about that treatment is not effective. This is about other issues that we need to be discussing with these countries, why their measures are so poor. So we know that treatment is so effective. So almost 9 in 10 HIV-positive people on treatment in our region have achieved viral suppression. Again, some variation between our region, between the sub-regions, more than 90% in the west, 74% in the east. And again, huge variation, even in the west, between 32 and 98%, 14 and 99% in the center, and 42 and 86% in the east. So once you've reached these 3 targets, as I said before, UNAIDS estimates that you will be on track towards ending AIDS by 2030. So this is this 90-90-90 is 73%. So you see the global target is 73%, and the regional average as a whole is 43%. A number of countries again have reached these targets, whereas many countries on the right will face huge challenges or are not on track to end AIDS or reach these targets by 2020. So 3 in 5 people living with HIV in Europe and Central Asia are not virally suppressed. And so this is what's driving the epidemic in Europe. There are people who are undiagnosed. There are people on treatment, diagnosed but not on treatment, and then people on treatment that are not virally suppressed. So these 3 categories of people are the people that are driving the epidemic. And in the report that we're about to publish, we're going to estimate the proportion of these 3 categories that are driving the epidemic based on the data that we have. So again, big sub-regional variation here. 73% was the target. So in the west, we pretty much reached this target, whereas in the center and the east, very few have reached this target. And again, huge variation also on the 73% target. So how close are we to reaching the 1990 targets in Europe and Central Asia? So 80% overall have been diagnosed, 50% are on treatment, and 43% have reached viral suppression. But again, breaking this down to subregions, in the West, we're doing better. We've reached 72% viral suppression. So from that perspective, we can say that we've almost reached the target, or we have reached the targets in advance of 2020. Looking at the center, we're doing quite well in terms of diagnosis, but we see the drop-off when it comes to ART and viral suppression. And the eastern parts of the region also a drop from the diagnosis, but also mainly the biggest problem starts with treatment and then followed by viral suppression. So this is how we're performing. So this is a question that we've been trying to answer. Is viral load and undiagnosed fraction impacting new HIV diagnosis in Europe and Central Asia? And this is not very easy to answer. So what we see here are these new diagnosis trends, as I've shown you before. And what we're going to see now is, a point in time. So those are trends, but here we're going to see a point in time when it comes to viral suppression. So in the West, 72% viral suppression, 14% undiagnosis rate, and we're seeing a 19% decline in diagnosis over the past decade. So this is something very promising in the western parts of our region. In the center, viral suppression drops to 45%, a slightly higher undiagnosis rate, and we're seeing a significant increase in new diagnoses, albeit from very low levels. So this is important to take into account. And in the East, even lower viral suppression rates, 26%, higher undiagnosis rates, and we see doubling of the rate per 100,000 population in the eastern parts of the region. So I think even though it's difficult to make causal links here, I think it's fair to say that their community viral load is impacting new HIV diagnosis in our region. And just to end, we've come a long way in terms of general population continuums in a very short period of time, and I think this is where hepatitis is heading towards. I think you're going to have bigger challenges when it comes to hepatitis, but I think we need to start asking these questions. What we want to do now for HIV is really focus on the key population continuums, and this is a huge challenge for countries in our region to disaggregate their data. As you see at the bottom here, so the red here is MSM, PWID in green, and migrants in blue. And as you see the numbers here, only 10 countries are able to disaggregate the data, break it down by key population, or for MSM. Only 8 countries for people who inject drugs, and only 5 countries can do this for migrants or foreign-born populations. And as you see here, this is the continuums for these very few countries, so we have to be careful making too much noise about this. But what I've done here is, in the gray boxes here and the lines, you see the continuum of care for the national continuum of care for the same 10 countries for MSM, the same 8 countries for people who inject drugs, and the same 5 countries for migrants. And you see how the same countries, so if you compare, for example, the people who inject drugs one, you compare the numbers for people who inject drugs with the national continuum for the same population. And as you see, for people who inject drugs, the big drop-off happens at ART, whereas for migrants, it's small drops all along the way. And for MSM, they're actually outperforming the national continuum because they have very close links with healthcare settings. So that's positive. But still, so this is something that we're working very closely with to try and support countries disaggregate their data, and that's where we're going to focus our attention in the next 2 years. So to conclude, I think I've showed you that there is significant variation along the steps of the continuum of care between and within subregions of Europe and Central Asia. While the western part of the region is closing in or have reached these targets, 1990 targets, central and eastern parts are lagging far behind, especially in the eastern parts. In terms of priorities, pretty straightforward. Testing is a key priority in our region. We're seeing declines now of HIV infections in some capitals across Europe, and you've probably all heard about the dramatic declines in London for the 2nd year running now, so we're very excited about this. And what they are attributing this decline in is the huge shift in testing culture that's happening in London, especially among gay men in Soho or very concentrated clinics in the centre of London. So not only are they reaching the right population, but these gay guys are getting tested multiple times, very, very frequently. So that's a huge issue that I think we all need to be learning from. The second thing they're attributing what's going on in London is this linkage to care. So very quickly, the same day that they are diagnosed with HIV, many people start treatment. And this is something that we're going to need to be focusing more on. You saw the time to diagnosis, but there's also a time to ART that we need to be looking at. And also the issue of retention and adherence. The more people are getting affected, the more importance we have to be putting on keeping them in care and providing the support that they need. But all this has been focusing on the continuum, and it's easy to talk about the prioritization, but I do want to push the issue of primary prevention that is getting less and less attention. It's always received very little attention, but now in the era of treatment and primary prevention, there is very little funding for prevention in Europe today, and that is something that we would like to see more of. And also, after the continuum stops at the third 90 now, but there are initiatives in Europe now trying to develop quality of life indicators, so we start monitoring this as well. And we're involved in that project, and we'll be happy to field test these indicators as they become available. Lots of people to acknowledge, we rely totally on the many people in this room who work with surveillance or monitoring and provide data to ECDC from the full region. And without that, we couldn't have done any of this. So huge thanks to them. Also, huge thanks to Anastasia, my colleague. And these are some of the consultants working from the UK that have helped us with this analysis. So thank you very much.